This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
Alrighty. Good evening, everyone. Thanks so much for being here today. We know how valuable these evenings are for you all, especially during this time of additions and applications and everything. So we appreciate you all being here. My name is Andrew Day. I'm one of the co-chiefs alongside my amazing co-chief, Caroline Gormley.
Hi, I'm Caroline
We
Gormley.
know there's a lot of avenues to learn about our program, but our goal with this presentation is give you those highlights of our program, just everything we love about our program. So here's our program leadership. It starts with Dr. John and our program director and Dr. Tonkin. When people ask us, the question like, what is the culture like at our program? I always say it's like a family. It's so cliche, but it's a group of incredibly selfless, motivated, caring people. And that starts at the very tippy top with Dr. John and Dr. Tonkin, and then kind of trickles its way down to our attendings and residents. It is never really a no from these two. It's always a how can we make this happen? They are inspirations with their leadership and their patient care, and it's a blessing to work with them in their respective clinics. And this is us, me and Caroline hanging out one day with some of the PGY2s and 3s. And here is our Minnesota Gopher PM&R family. We're a very diverse, unique group. Some of us born and raised in Minnesota to all across the country, but not only kind of where we're from, but the experiences that us bring, whether it was experienced prior to medical school or after medical school. Some of us were orthopedic surgeons prior to PM&R residency. Some of us were hospitalists, pediatric residents. And this is amazing because we have such a unique group with such unique perspectives in how we practice medicine, how we view rehab. And it just makes for really great discussions during didactics and during our training. And I think an important reason why we have such a unique, diverse group of residents starts with our application process. We review every single application by hand. We value unique experiences that may not come from Minnesota or the US. Every application starts equal no matter what kind of background applicant it comes from or is from. And I think that just match every year. A good example of this is if you go to our website and take a look at a list of the Our Residents page, you'll see such unique backgrounds for every class. And I think one thing also that adds kind of to the unique perspectives is that we have categorical and advanced positions. So that advanced resident will start their PGY2 year with us, and they just come in with such a unique perspective on the medicine aspect of rehab, and that's always valued in our program. In terms of logistics, I know that's why a lot of you are here. Essentially, how this works with your rank process is you'll essentially rank both the categorical and the advanced programs separately if you interview here. So it's one interview, not two separate ones. So for example, for me, I knew I wanted to come to this program, so I ranked categorical UMN 1 and advanced UMN 2. Here's the rotation schedule for the rehab years. So this is PGY 2 through 4. We have all kinds of areas of rehab, to sports medicine, to cancer rehab, to plenty of inpatient neuro, where you work with all kinds of patients, the spinal cords, the brain injuries, the ability, the transplants, the LVADs, everything like that. We have a really awesome rehab, pediatric rehab hospital at Gillette, which is always a great rotation and has a really good mix of inpatient and outpatient rehab exposure. And our program director, Dr. John, leads the clinic rotations at the U, and she works in cancer medicine and is a really great person to rotate with while during our time there in a field that continues to grow. And I always highlight this because we go to so many different rehab hospitals. And I think one really unique thing about our program, and it's not a good or bad thing, it's kind of just an A or B thing. Because we go to 5 to 6 different hospitals. We go to a private hospital, a peds hospital, academic hospital, a level one trauma center, a VA system. By the time we graduate, we know exactly the kind of system that we want to work in. We know that, like, hey, maybe I really want to work in an academic setting. I don't want to work in X setting, and I want it to kind of run like this. You know, sometimes if there's certain, for example, programs that maybe you would stay at the same hospital system for 4 years. Again, some people really like that. But for example, if it's an academic hospital that you're working at 4 years and you're applying at the end of your residency, and all the practice is private or all the practices are um, VA system, for example, then you're not really sure what are the ins and outs. And I think this is a really awesome part of our program is that we get so much exposure to different types of rehab because rehab looks a little different in every different system. So I think it's a really cool aspect of our program. I'll pass in terms of kind of the location of these hospitals and then a little bit about intern year.
Awesome. So these hospitals are all located within the Twin Cities. The max of a commute is about 20 minutes. And as Andy was saying, it can be a really diverse, different patient population at each of these sites. Some more inner cities, some more in the suburbs. It just depends. And we also live in different areas throughout the Twin Cities overall. So since you all are closest to intern year, we like to focus on that too and what we offer in our intern year. So intern year obviously is hoped to prepare residents for PM&R and focus on rotations related to rehab, such as neurosurgery, neurology, orthopedics, rheumatology, things like that, where you get a little bit of procedural skills, but also get to talk to those colleagues and be able to build those relationships that you'll use through the next 4 years. And additionally, there's no call intern year. That's one of our perks, which is kind of nice. It's rare that you'll be on the weekends. There are some rotations that you'll be working on the weekends, but that does provide some good time for you to learn and to get acclimated to the area as well. Additionally, interns are able to join in person for PM&R didactics. I want you to ask every program if you can join as an intern for PM&R didactics. So this is actually a very unique opportunity. We're not only able to bond with our interns since year one, all the way through year four, but also start to learn what is PM&R and how can I be the best PM&R physician that I can be, which is really unique and special to our program.
Yeah, I agree with Caroline. Like, I cannot tell you how good it was for my mental health to get through intern year and to see my people every week and to learn about rehab topics every Wednesday for 4 hours. Because you're going to go through fourth year and you're going to meet all these amazing people during interviews. And all of a sudden you get to intern year and maybe it's a medicine year or a TY year and you're not going to be able to do as much rehab and you miss your kind of people that you've met and worked with for all of fourth year. So it's been really awesome to have our interns and at every didactics. Carolyn, you want to go a little bit
Yeah,
to the
additionally,
mentorship?
we have, yes, thank you, Andy. Yeah, additionally, we have a mentorship program that's starting to be more and more robust. We're able to pair residents with senior residents, so it's more of that informal mentorship on day one, and having those seniors kind of guide you through what residency really looks like as they have just gone through it themselves. And then you're also able to have a resident and faculty pairing that is official from this early on time too. As you get to know fellow residents and fellow attendings. Obviously, this can shift a little bit, but it's pretty exciting to have these official pairings as well available for you for support throughout your whole residency. And then additionally, we have an opportunity for continuity clinics. So I apologize if I'm kind of looking up because I actually have had this opportunity to work with Golden Age Games out in Salt Lake City. So I'm currently covering some sporting events, which is pretty exciting. But I feel like, as Andy pointed out before, our program is really aimed at supporting what your goals are. And so part of that is having that flexibility in the Thursday afternoons for those clinical rotations. And so you're able to choose whichever faculty from any specialty, any location that you want, to try to learn the best that you can and be the best physician that you want to be, which is pretty special. This is at least every other Thursday in clinical rotations that you have this available. And so, for example, Andy over here is able to do some acupuncture, some other medicine at the VA and other rotations. And I am interested in pediatrics. So I'm able to rotate at our Gillette at our pediatric hospital here every Thursday if I desire, which is really great. And then again, able to reinforce that mentorship.
And Caroline's doing sideline coverage right now, so props to
Oh,
her.
I'm
Claps for Caroline. Tore their ACL or something, feel free to step away.
Thank
Our
you.
call schedule is essentially residents create their call schedule for all the rehab rotation for one. The Pete's Hospital plans kind of a year ahead. And what's really, I tell our PGY new PGY2s who are just practicing rehab to book their flights home for Christmas like 6 months in advance. We'll make it work. Like we have such a great group. Maybe some residents have family here in Minnesota and don't need to travel. Maybe they can take half of the Christmas week. Always make it work. And I think that shows kind of the selfless nature of this group, but also it's really cool to be able to create a call schedule because then we can kind of plan around any kind of family or any events that pop up. We usually do it 1 week at a time. It's pretty typical call, and we do home call, so you won't have to stay in the hospital for that. Here's some of the fellowship matches. So our recent graduate class matched in all sorts of areas of rehab, from peds to sports, to pain and even cancer. This class in particular matched to Colorado, Spalding, JPS in Texas, Georgetown, and then Grant staying here for pain medicine in the University of Minnesota. Here's a list of fellowships that we have at the U, including sports medicine, which is a new one that we have. We have these really unique tracks that we offer here that are longitudinal tracks, that are formal tracks that you get a certificate at the end for, that residents can do activities or learn more about areas that they're really interested in. We have an educator track where if you love teaching, whether it's you teaching medical students or residents or anyone, that would be a really awesome track for you. I think that's also, I'm personally in it, so I'm a little biased, but it's a really unique track. I didn't find many programs that had something that catered to teaching, so we have a track for that. We have a track for sports medicine that really sets residents up with awesome opportunities for sideline coverage. And then we have a track called Muscle, which is a longitudinal ultrasound course where you, what did we call Kirsten, Caroline? The ultrasound wizard by the time she graduated. She was a wizard with the ultrasound probe. And if you really love that kind of stuff or could see yourself doing that in the future, Muscle would be an awesome option for you. I kind of summarized through these tracks just for sake of time, but the really awesome part about this is you can jump into most of these informally or formally. So maybe on day one of intern, you're not so sure, what intern year is like, and maybe you're still developing some interest in rehab. You can kind of hop it in and out of these certain tracks to see if you like them, and then apply second year, for example, if maybe you got intern year down your belt and you're now all of a sudden in sports. Like you can jump in and out of these tracks, or you can apply day one of intern year. And just like our didactics, our interns get to participate in these tracks, which I just think is amazing. See if I miss anything. Educator track, so we teach the medical students at the U. We learn how to be a better teacher. Prism is a bunch of sideline coverage. Caroline, do you know by any chance like any examples of any sideline coverage opportunities we have?
Yeah, definitely. Well, for example, the Twin Cities Marathon is coming up. We have some sideline coverage available for that. We have a local hockey and a local football team that we're able to provide some coverage. And then, for example, I am here out in Salt Lake for a week covering sporting events for our vets as well. So we have those opportunities throughout the year and then day to day.
Awesome. Here's the logistical part of resident benefits. I think it's really cool. We have $3,000 to help support us to go to national conferences, board review books, technology, anything you want. We have food stipend at certain sites, which is always great. Free food is always great. We have free covered parking at really pretty much all our sites, and some educational days as well as paid time off. We have a lot of well-being and professional development opportunities as well. One thing I really like to point out is the Women in PM&R committee that was co-founded by Caroline, and the DEI committee. Are there any of these that you want to highlight, Caroline?
Yeah, definitely. So Women in PM&R is something to build that mentorship, but then also just bond with our fellow residents who identify as women or genderqueer, which is pretty exciting that we are able to start that and are really supported by our trendings as well as our co-residents. Additionally, there is the DEI committee throughout the university, and this has other factions, including international med grads and other things. For example, I'm part of the LGBTQ group with that DEI committee, and we do some social events as well as some volunteering, which is pretty fun to be involved in all of that in the community as well as locally.
Okay, 5-minute warning.
Awesome. We have a wellness committee here, and this wellness committee is made up of one represented from each class, which I think is really cool that we have representatives from every class from PGO1 to 4. And we help plan our biannual wellness days. We help organize speakers to lead discussion related to physician wellness, and we organize kind of monthly resident events. Our residents, especially kind of interclass and everything, hang out all the time, but we also like to plan these more formal events of like, hey, on Friday at the end of our block, we're going to go out to here and just hang out and or play pickleball one day. So the wellness committee is a really unique committee that we have here. And it's nice that Dr. Tonkin, one of our program directors, and leads our committee. So he helps us get things done from like a logistical standpoint. And then we have representatives from each class who bring different perspectives, like I talked about at the very beginning, on kind of how the overall wellness of our residents are doing and how we can continue to improve it. Caroline and I are both born and raised in Minnesota. So what's a question we always get every Minnesota Monday, Caroline? What are winters like in Minnesota? How the heck do you get through them? There is so much to do outdoors in Minnesota. And one thing that Minnesota does really well is it clears our roads really well and early. I remember coming home from an ED shift at like 3 a.m. one day during my intern year, and like the roads were already plowed after a big storm. We also have tunnels essentially from kind of where our main didactics are held on campus. We have a tunnel that goes from the parking garage all the way to the didactics room, so you don't even have to step outside to get to weekly didactics. And there's plenty of opportunities for sports coverage even in the winter. Caroline and Dr. Hicks and Dr. Chumi and Dr. Volker in that small picture there, we're doing some sports coverage even in the winter. So we all commiserate together. We all find fun things to do together. We have plenty of residents from Mexico, Brazil, Malawi, Africa, and they've all made it. So if they can make it, you all can make it as well. And in the end,
2-minute
this is the
warning.
question why you're here, right? Why University of Minnesota? For all the reasons we just talked about, did I skip a slide? Oh, for all the reasons we talked about, it really is a family here. We do things together. We love our program, but not only we love our program, but we are comfortable enough to provide feedback to continue to improve our program. Here's a bunch of pictures of us hanging out together. These are the middle pictures are us at like a PM&R and AP. We got to do a pickleball day for one of the wellness days. If you didn't know what pickleball is, it's getting really big in Minnesota. Got to play some beach volleyball with some of the veterans who worked at the rehab center at the VA, which was awesome. Dr. John, our program director, holds a holiday party. If you look really closely in the top right, that's actually our director, Dr. Tonkin, from last year. He's dressed up as Santa. He brought in a bunch of like gifts for all the kids in our family or for in our residency, and they absolutely loved it. Other cool things, we already are grooming our Gopher class of 2025 in the middle picture there, with one of our co-residents who had a baby during residency. And these are just more pictures of us at various hangouts. The top middle particular is really unique because we got to go to Courage Kenny and try out some of the adaptive wheelchairs. That's pretty much it. There's more pictures there, but just wanted to shout out our social media. There's a QR code, so you can find us on Go for PM&R. You know, even if you don't have social media, I think it's a really awesome avenue to see all the fun things we do as well as all the learning opportunities we have. If you guys have more questions, feel free to reach out. Application questions, program questions. If you need contact information, there's our email. It'll send the email to Caroline and I. We hope to see you all in the application season and the application trail. And thank you, PM&R Scholars, so much for having us. Hope this was helpful.